The discussion about diabetes, drugs, or better lifestyle. Now, you'll hear in this discussion, it starts off, there's no question, lifestyle trumps drugs. But for a lot of people, myself included, you sometimes need help. I, for example, took metformin for years. And then recently, as I've continued to age, continued to get some resistance problems with my insulin receptors, I've started taking PIO as well. We'll talk about those. So, diabetes, drugs or a better lifestyle. So just the basics, you know this, diabetes more than doubles the risk of developing and dying prematurely from heart disease, strokes, other problems. It's also the number one cause of blindness, the number one cause of kidney disease, and going on dialysis. It significantly raises the risk of stroke, dementia, nerve, kidney, and eye damage, blindness, impotence, decreased circulation, legs and feet, etc. In the early stages of diabetes, most people don't experience symptoms. We'll talk about those in just a second, but here's the thing that I see over and over and over again. People say, well, what are the symptoms of diabetes? And they talk about what we're going to mention in a minute. But the bottom line is the vast majority of people, when they have this problem, have no detectable symptoms. Do not depend on symptoms to give you a warning that you have this critical problem. Symptoms can be mild, they'll be intermittent for years, delaying diagnosis, and again, you won't notice them. People talk about fatigue, blurred vision, frequent urination, numbness or tingling in the hands of the feet from nerve damage, weight loss, weight gain, increased thirst and hunger. In fact, what you tend to see more than anything else with insulin resistance is weight gain because of that continued high level insulin in your body. Metformin is the first line medication for the treatment of type 2 diabetes, particularly in people who are overweight or aging. Why wait for a disease and hope for a cure? I used to be an ER doc. My name is Ford Brewer. I quit ER after a few years because it was just so frustrating. Most of the things bringing people into the ER are things that should have been prevented, including heart attack, stroke, number one cause of death, number one cause of permanent disability. People think that you're just going to have those and that they're not predictable. Both of those are wrong. They are predictable and you don't have to have them. Usually it's lifestyle. Lifestyle is more important than supplements and even prescription drugs and even stents and surgery. But the current times are tough. Major financial impact with the lockdowns that most states have been going through. We've been working on a way to make this much more affordable with a subscription process. And that's exactly what we're announcing today. We've got two levels. One is the silver membership, where you get access to our courses, a private webinar each month, and access to our supplement store and supplement recommendations and prescription. Or I would suggest even more so, the gold membership. You can get a script for a Freestyle Libre and find out what your blood sugar metabolism's doing on a daily basis. And you can get a lab order for inflammation, OGTT, and insulin survey. You can also get a 30-minute one-on-one with me. So I'm looking forward to seeing you. Cost is no longer an excuse. So if you're interested, go to go.prevmedheartrisk.com/prevmed-subscription or call us at 859-721-1414, 859-721-1414, or email us at myhealth@prevmedheartrisk.com. Looking forward to seeing you. Thank you.